Good afternoon. We'll start. It's already 2 o'clock. Welcome all. Please mute yourself, but always show your video picture. Sign in your name, Facebook account, or email address in the chat box. Please include the names of your companions attending this pep talk. Use the chat box to ask questions and make comments while the pep talk is on. Group pictures at the start and end of pep talk will be done. Please show your face in the video. As a reminder, please take the online learning cum evaluation test exercise or OLETE for mastery of learning and have a perfect score to get a certificate. I have placed the link in the chat box already. The certificate will look like this. Okay, so let's now have a group picture taking before we start the pep talk proper in 2 minutes. Please turn on your video now. Please show your face. Okay, page 1. Ready? Everybody show your face. If you want to be included in this souvenir. Okay, 1, 2, 1, 2. Okay, wait, pahabol. 1, 2, 1, 2. Okay, 1, 2, 3. Okay, give me a second to save it before we go to page 2. Okay, page 2. 1, 2, 3. Okay. So let's start. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. What I have in mind in my pep talk, which may run for 3 years, is to empower at least 30 persons with my family members and my patients as a priority. This is my key performance indicator. I hope you will be in my group of 30. I launched this pep talk on May 15, 2021 with a module on COVID-19. The second module was on patient empowerment. Third module, patient management process. Fourth module, rights in patient empowerment. And we are now on the fifth module, staying healthy and contented. There are 5 parts: introduction and intentional living plan, healthy lifestyle plan, screening and periodic health check. And we are now on this particular module, this part, early diagnosis and early treatment. And then next week, we will have first aid and basic medical care. My pep talk today is entitled Staying Healthy and Contented, Early Diagnosis and Early Treatment. The empowerment objective is for lay people to have an understanding of the use of early diagnosis and early treatment as a strategy in staying healthy and contented. This pep talk is being conducted with the assumption that you have attended the ROJoson pep talk on screening and periodic health check, which we took last week. So one tactic to stay healthy or alive as long as possible is to have early diagnosis and early treatment for a discovered disease. Early diagnosis can be promoted by periodic health check or by symptom-based early health check. To repeat or for review what I mentioned in the ROJoson PEP talk on screening and periodic health check, screening and periodic health check is used for people who are asymptomatic, apparently healthy, who are screened for early detection of diseases so that they can be treated early enough to avoid disability and death. So the question that we posed last time, should I have a periodic health check or periodic health examination? The answer is yes and no. Okay. After removal of the legal requirements like the newborn screening, okay, occupational, travel, and organizational requirements. The answer is yes if you and your trusted physician have assessed that you, who are generally healthy, have a higher risk for developing a particular disease because of a strong family history. Some would use age as an indication if there is a high incidence for a particular disease in a certain age group. If you should undergo screening, screen only for the identified disease at risk. The answer could be no if you and your trusted physician have assessed that you, who are generally healthy, do not have a higher risk for developing a particular disease as compared to the general population in your age group. The other supporting reasons for the no answer is studies have shown that general or routine health check had not, I repeat, had not reduced the morbidity and mortality, either overall or for particular diseases like cardiovascular and cancer. The practical recommendation is to be selective using the risk-based approach. Another reason for the no answer, just like in curative medicine, the biggest pitfall in disease prevention, which screening is a strategy, is that things that ought to work do not always do so. So no guarantee. So even the strategy of screening has had its failures. The presence of false positive results in screening tests has many asymptomatic patients wrongly labeled as being ill. So instead of improving the quality of life of these people, this phenomenon of false labeling has been found to wreak havoc on the social, psychological, physical, and financial stability of the unfortunate individuals with false positive results. Furthermore, false positive results often lead to a battery of expensive and unnecessary follow-up procedures. The presence of false negative results can give a false assurance that everything is okay, which may lead people to ignore or minimize new symptoms. A lot of times, instead of an ounce of prevention is worth a pound of cure, it will turn out that the pounds of prevention translate only to just an ounce of cure. So if you don't go for a periodic health checks and periodic health examinations, make sure to listen to and watch your body closely for symptoms of a particular disease. Once symptoms of a particular disease occur, consult a physician right away. So with this strategy, you still have an opportunity to catch the disease early. So the other way of promoting early diagnosis aside from the periodic health check is the so-called symptom-based early health check. Symptom-based early health check means that at the onset of the symptom, a patient consults a physician right away for early diagnosis so that a discovered disease can be treated early enough to avoid disability and death. As mentioned, symptom-based early health check also carries an opportunity to catch the disease early. So which one is better, periodic health check or the symptom-based early health check at the onset of symptoms? So which is better in terms of early diagnosis? If there is a difference, does the advantage of earlier diagnosis of one approach translate to better outcome in terms of reduced morbidity and mortality? Theoretically speaking, screening at the stage of no manifestation of symptoms yet in persons with an actual disease that is being done in periodic health check has an advantage of earlier detection of the disease compared to symptom-based early health check where there is already symptom. But the question is, does the advantage of earlier detection of periodic health check translate to better outcome in terms of reduced morbidity and mortality? At the moment, or up to the present time, there are no robust or strong randomized controlled studies comparing the two approaches. However, there are studies that show periodic health check had not reduced the morbidity or mortality, neither overall or for a particular disease like cardiovascular diseases and cancer. It may be that as long as the detected diseases, assuming that they are detected in the early stage, is treated early, whether discovered through the periodic health check or symptom-based health check, the result would be the same. One has to take note that although majority of diseases detected on periodic health check will be in the earlier stage, there will still be a minority in the later and even the advanced stage. The same probability goes for symptom-based early health check. So for the two, nothing is 100% perfect. Because of the absence of robust studies, I made a statement that it may be that as long as the detected diseases is treated early, whether discovered through periodic health check or symptom-based health check, the result would be the same. I made this statement in the background of a robust studies on breast cancer surveillance that can serve as an analogy. So there are two schools of thoughts in breast cancer surveillance. Breast cancer surveillance here meaning screening for cancer recurrence and what will happen after a definitive treatment has been done for the breast cancer. One school of thought is using a battery of tests, a lot of tests, routine tests like CT scan, ultrasound, okay, even in the absence of symptoms, just like what is done in periodic health check. The other school of thought is symptom-based, meaning doing tests only based on the symptoms or when there are already symptoms, similar to the concept of symptom-based early health check. Randomized controlled studies, so these are robust studies, have shown that although symptom-based surveillance would detect breast cancer recurrence later than the periodic battery of test surveillance, the final outcome would be the same. I repeat, the final outcome is the same. The survival rates would be the same for both types of surveillance. An advantage of the symptom-based surveillance would be better quality of life because of shorter period of anxiety before death. In the ROJoson PEP talk on screening and periodic health check, false positive and false negative results are the downsides of this approach. How does the incidence of these false results compared with that in symptom-based early health check? Again, there are no robust studies on this issue. However, theoretically speaking, the incidence of false positive and false negative assessment in symptom-based early health check is expected to be lesser because of the presence of additional data, which are the symptoms that can be inputted, processed, and correlated in the analysis by the physicians. For the periodic health check, there are no symptom-based symptom data to be correlated with. So symptom-based health check is another approach to promote early diagnosis. So what essentially is symptom-based health check that can promote early diagnosis? I repeat, symptom-based early health check approach means that at the onset of symptom, a patient consults a physician right away for early diagnosis. So what is a symptom that in the context of physical health? A symptom is a feeling or observation of a person or a patient of something unusual in the body, which can be a manifestation of a medical condition or illness. Examples of symptoms are fever, cough, colds, pain, discoloration like redness, lumps, masses, etc. Persons with a medical condition or illness usually experience a symptom or several symptoms. However, there are persons with medical conditions who do not manifest symptoms at all. So such persons are labeled as asymptomatic. Symptoms are not equivalent to medical condition or illness per se. They are manifestations of a medical conditions or illness that might be present. So what to do if a person experiences symptom or several symptoms and when to consult a physician? The natural first reaction of a person experiencing a symptom or several symptoms is worry. This worry may progress to anxiety if the person does not know what the symptom is indicative of, is not confident of managing the symptoms, and not confident it will or can be resolved right away. Thus, at the very start of the onset of symptoms, a person must know what to do to manage the worry. The possession of basic medical knowledge on symptoms will be helpful, such as knowing the organ or system that might be involved and their common disease implications. For examples, fever may indicate an infection is going on. Cough, when you have cough, it usually comes from the throat or the lungs. Colds comes from the nose. Yellowing of the sclerae usually indicate a liver disease, a liver problem. So all persons have the freedom to do a self-diagnosis of their symptoms, no matter how crude and tentative it is. At the crudest level, they must know which organ, tissue, or body system is involved. They can go further, even just a perception or a guess, what kind of disorder may be present. Is it inflammatory, infectious, tumorous growth, cancer growth, or benign growth, hormonal, trauma, etc. They can seek help from the internet, which is readily available. They can ask around even before seeing a physician. So once a symptom or several symptoms occur, wait and watch and monitor closely with the hope that everything will turn out well. The best hope is for the symptoms to disappear spontaneously in due time and soon. The next best hope is for the symptom not to be part of a medical condition called disease, because there are a lot of symptoms that will just represent not a disease, but just a condition which will just spontaneously disappear. Next hope is for the symptoms, if diagnosed early or if diagnosed already as a medical disease, it will be something curable in due time and soon, and to be able to be treated easily with non-invasive procedures, with a short downtime, and with the least expense. So, fortunately, in the real world, majority, as high as 90% of symptoms felt at the start are non-specific and will regress or resolve spontaneously, even without medical intervention. Again, one has just to wait and watch and monitor with the best hope. One should not panic right away and do irrational intervention. One can be worried, but one should not panic. Just wait and hope for the best. If the symptoms persist and progress, it is time to consult a physician. 2 weeks to 1 month is a generally safe watch and wait period, as long as there is no urgency, no life-threatening situation. Patient can consult sooner if indicated. Patient consulting a physician at this point is what is called symptom-based early health check. What happens at symptom-based early health check? The patient consults a physician. This is what is called a medical consultation, which is defined as a patient or a relative of the patient voluntarily seeking out a physician to get professional advice on certain medical concerns. The physician, as a matter of basic routine, interviews and does physical examination of the patient to get to a clinical diagnosis. The physician looks for symptoms together with the signs. Signs are the findings obtained by the physician after doing a physical examination. To make a diagnosis, physicians combine the collected symptoms and sign information and see if they can be reflective of a pattern or picture of a known medical condition or a disease. If they are, then the matched medical condition or illness is the diagnosis. With a symptom-based early health check, hopefully the clinical diagnosis made by the physician will end up with an early stage disease or no disease at all, after all. If an early stage disease is diagnosed, this should be followed by early treatment to get good results. A late treatment by the patient, for whatever reasons, will negate the gain of early diagnosis made by the symptom-based early health check. That symptom-based early health check can still provide an opportunity for early diagnosis if a periodic health check is not done, but the early diagnosis must be followed by early treatment to be completely fruitful and beneficial. So there you are, symptom-based health check. Early health check is shown available for early diagnosis aside from the screening or periodic health check. Symptom-based early health check means that at the onset of symptom, a patient consults a physician right away for early diagnosis so that a discovered disease can be treated early enough to avoid disability and death. It also carries an opportunity to catch the disease early. Vigilant self-observation and monitoring. So make sure to listen to and watch your body closely for symptoms of a particular disease. Once symptoms of a particular disease occur, consult a physician right away. A thing that has to be emphasized again, if an early stage disease is diagnosed, this should be followed by early treatment to get good results. A late treatment by the patient for whatever reason may negate the gain of early diagnosis made by the symptom-based early health check. So with this, I end my pep talk, staying healthy and contented, early diagnosis and early treatment. I hope I have empowered you to have a better understanding on the use of early diagnosis and early treatment as a strategy in staying healthy and contented.
Okay.
Before we go to the next part of the program, let me put up this reminder again. Take the online home evaluation test exercise for mastery of learning and have a perfect score to get a certificate. I have placed the link in the chat box and also in the Facebook page, the group, and also in the Viber group. Let me just report as the status of the pep talk and the Olete. A shout out for these 7 people, these mentees. Rochelle de la Cruz, Rex Tolentino, Chris Nesesia, Beto Mambing, Christy Sara, Cora Hoson, and Therese Hoson.
Yes.
Okay, they're up to date. They have even finished the 3 write-up on advanced directive and also the intentional living plan and healthy lifestyle plan.
Ito lang pangalan ni Ate Babes.
Congratulations. Okay. Let me announce also that I'm contemplating on the ROJoson PEP Core Course Achievement Day. So this will be held on October 16, after a week after the last PEP Talk. Okay. By the way, next week we will have a PEP Talk on the first aid and basic medical care. And then I have added a new topic, food supplements, are they necessary? Okay. So I think this is still pertinent in terms of the theme of staying healthy and contented. Okay. So going back, we will have a recognition day on the achievement of the mentees. So please try to complete all the OLETE requirements by October 13 so that I can be ready with the program on October 16. So we will also ask for a picture of the achiever, okay, color, digital size, okay, a digital passport size copy of your portrait picture, okay. So as I said, Achievement Day will be October 16, 2021. Okay, hopefully we can carry this out. Okay. So with that, I end this pep talk. Okay, let's now have a group picture taking before we start the QA interactions. Please show your face now. Page 1. Okay, let's have a page 1. 1, 1, 2, 3. Page 2. 1, 2, 3. Okay. Okay, the floor is now open for questions, interactions, comments, suggestions, etc.